DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. We're going to have a great show today. We will have Dr. J.D. Folsom here from Rexburg, Idaho with cattle health and reproduction services, and we're going to talk about pregnancy testing, about interpretation of those pregnancy tests, and much more. He's a great wealth of information, so stay tuned.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk, and I just want to say welcome to Dr. J.D. Folsom. Thanks for being on the show.
It's good to be here.
It's great. Dr. Folsom has his practice in Rexburg, Idaho, and it is cattle health and reproduction. And we've been acquainted for many years. And Dr. Folsom is one of those leaders in our veterinary profession and in the beef industry. And for me to be able to catch him and get him on the show, it's a great honor. So thanks for being here.
Well, yeah, it's a pleasure for me to be here as well. So,
and beautiful part of the country that you live in.
Yep. So we're just on the west side of the Tetons. And so, yeah, it's really pretty right there in the Snake River Valley, Snake River Basin. So
that's
awesome.
Awesome.
Good place to be.
Yeah, awesome. So tell us a little bit about your practice.
We're like probably 95%, just beef cattle. We do the occasional horse for one of our producers. But aside from that, we do take care of some, like a big dairy heifer development yard. Mm-hmm. But aside from that, it's all just, beef cattle. And most of it's cow calf. We have some feedlots, a lot of guys that background their calves, and then a lot of guys that'll feed their calves before they go back to grass that following summer. But that's, that's the kind of the extent of our practice. We do lots of ultrasounding for pregnancy, diagnosis, fertility testing bulls. That's a big part. We do a fair bit of embryo work for clients, do some breeding. And so, but that's, that's the mainstay of what we do.
It's awesome. And this, we're going to talk about reproduction and Preg checking and ultrasounding and different things like that for cow-calf producers. But, the one question I get is hey, why do I Preg check? And it seems pretty, for you and I, it seems like, well, why would you ask me that?
Right.
But, we have people out there that aren't. And so what are some of the benefits, or what do you see as the biggest benefits?
Well, we live in an area where, we have considerable snow in the wintertime. And so, from by usually Thanksgiving, we're feeding hay or some sort of ration to these cows. And so if we can Preg check it, if they're not carrying a calf, send them to town. There's no sense. You probably spend $200 at least, $300 in feed. Some guys feed cattle till mid-June before they go back to grass.
Wow.
And so, you got a considerable cost into these animals. And also with Preg checking, you can, if we can get access to the cattle early enough in the fall, a lot of people in our area will run cattle up on Forest Service, and sometimes you just don't have access to them. But if we can get to them, we can stage those cattle into cycles, or the month that they're going to calve. And so, maybe they need to thin down their herd. It's just a management tool so they can get, those late calvers,
yep,
narrow down the time that they have to spend calving cows. And so, I just think it's a no-brainer. As far as
So get two things there that you mentioned, and we'll wrap up and go to commercial. But one is making sure they're pregnant if you're carrying for the winter. The other one is the importance of staging them.
Yes.
So you know what you're carrying and how long that calving season is going to be, and
Yep.
and managing your resources.
Yep, exactly.
So phenomenal. It's a great start. We're off to a great start with Dr. J.D. Folsom. We're going to take a break. Thanks for watching DocTalk, and we'll be right back.
Hi, my name is Dr. Kirk Ramsey with Neogen. Today on Cattle Intel, we're going to focus on breeding soundness exams in our bulls. Cow-calf operations rely heavily on the success of bulls to breed cows. So using bulls without a breeding soundness exam is like driving a pickup without a fuel gauge. Eventually, you're going to be walking. So a good BSE, or breeding soundness exam, starts with your veterinarian checking your bull's physical condition, making sure the bulls have good feet, good conformation, normal legs and back, and overall body condition are all crucial for breeding activity. Another key element is testicular evaluation, looking at the size, symmetry, and development or even atrophy of the testicles. The penis is checked for injuries or abnormalities that could prevent breeding, but the exam obviously doesn't stop there. Semen is usually collected and analyzed for sperm motility, concentration, and shape. Remember, a BSE is just a snapshot in time, but it is the best place we can start. Remember to always schedule your BSEs at least 60 to 80 days before the breeding season. This allows for enough time for reevaluation if the semen quality falls short or the bull doesn't seem to up for what he needs to accomplish. Early detection is always going to save you money, ensures a productive breeding season. Don't leave your herd success to chance. Make sure to get good breeding soundness exams for your bulls.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
So I weaned my first set of calves and I did the whole herd. Calves that I had processed, they were all laying down or they were at the bunk. The second time we weaned, did my steers with the therapies, skipped the heifers. First day, the steers cleaned the bunk. The heifers, I bet they ate 25%. They didn't even eat enough to refill the bunk. The steers, they'd go to the water tank, they would drink, eating, and I'm like, this is really, really cool. No brainer.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson with Dr. J.D. Folsom, and he's from Rexburg, Idaho. Cattle Health and Reproduction, and is the name of his practice. And as we left, we were talking about the reasons to preg check. And so now kind of walk me through, when do you like to have your clients do the pregnancy test, and you know, what techniques are you using?
So almost exclusively ultrasound at this point. And I know there's some guys that'll use like an introducer, but I will actually I'll arm them just like as if I was preg checking them normally with the ultrasound probe in my hand. I feel like I can do a better job that way. Like with the heifers, like we'll start ultrasounding heifers mid-July. I mean, and a lot of that is you can see the whole calf. It's just easier to stage that and break those stages into cycles for those producers. And some guys will want to even get the gender of the fetus.
Yep.
And so it just makes it to where you can do that. So by mid-July, we're going pretty heavy with the heifers. And then again, if we have access to those cows, a lot of guys in our area have bulls in for 45 to 60 days.
Yep.
And we have guys that'll start, it just depends on when they start calving. We have guys that are big farmers and they'll start calving end of January. because they want to be off field so they can start working them. And then we have guys that don't farm and they don't start calving until March. And so a lot of that just kind of depends on when that aligns, if they can pull bulls. And then with ultrasound, we got to wait at least 30 days after pulling those bulls, so I can see a heartbeat on those calves.
So anytime after 30 days with the ultrasound. And then is there a time limit on the top end? Or?
Well, no, but I feel like you lose, in my experience, they get past 110 days, 4 months, you're losing, like that calf kind of drops deep down into the belly.
Yep.
And they're just more subject for error. And so, I mean, 110 days and less, I feel like we can be very accurate as far as staging when that calf is gonna calve. The further in gestation they get, there's more room for error.
So as we see, you're gonna see technology that comes along to, the do-it-yourself pregnancy tests and different things to that nature.
Right.
You can't stage them and sex them and do the kind of information that you're talking about.
And with that too, is they run them through the chute to pull blood or whatever it is, milk, and they don't get results for a couple days. So I know on the beef side, I know it's different on the dairy side when they have access, but on the beef side, they got to bring those cattle back in,
right, and
run them through the chute one more time or sort them, whatever it is. With us, like we know right there, if they're open, they can sort them off.
In real time.
Yeah.
So it's a tremendous service. The advent of the ultrasound has changed the game. And I mean, I'm a feedlot vet, so bear with me, but the accuracy on sexing, extremely accurate.
Well, I think it's more accurate sexing than it is staging. Like I feel there's variability, like depending on breed, calving ease, whatever that is, goals that the producer has, like there's going to be some variation in size, but I mean, like if between 90 days or 60 and 90 days, I mean, it's all but 100%.
That's awesome.
With doing the gender. So
that's awesome. Folks, incredible technology. It's great to get Dr. Folsom here on the show. We're going to take a break. When we come back, we're going to talk about interpreting those results here on DocTalk.
Plant the seeds of financial security today with United Patriot Coins Precious Metal Starter Pack, the Patriot Pack. Exclusive offer for our DocTalk family. Call now and secure your financial future. Strengthen your roots with silver and gold. Call United Patriot Coin today and ask for the DocTalk special offer.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrosyn by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrosyn.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrosyn.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Ranchers, looking to elevate your pasture management game? Turn to Heinen Brothers for expert aerial application. With state-of-the-art equipment and seasoned pilots, we deliver precision treatments right to your fields. From fertilizers to herbicides, Heinen Brothers has your pasture covered. Visit HeinenBrosAg.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. J.D. Folsom. And Dr. Folsom is the owner of the practice Cattle Health and Reproduction. He is located in Rexburg, Idaho. And, just one of those people that is salt of the earth, that is propelling the veterinary profession. And, to go out there and serve, we talk about rural practitioners and the need. We're just very thankful for what you do.
Yeah. Well, I enjoy it, so.
I know that. So let's talk about, so when you preg somebody's herd, tell me what you're interpreting if you're looking at their herd after you get done.
So first off, shoot side, like I always have a tech with me with like a handheld deal. And we're writing down, visual IDs or scanning EIDs, whatever it is, into this deal. And then it'll automatically, so I'll call days, like how many days pregnant they are. And then the program will kick out their due date.
Okay.
And then that way we have something nice, like an Excel deal that we can kick back to our client. But going into breeding season, if cows are in the body condition they should be, mineral status is good, just healthy in general, typically we're seeing in that 60-65% in that first cycle.
Okay.
Then you'll get another 30%, 20 to 30% in that second cycle, and then you'll get some stragglers in that third cycle. And so if something's wrong, if we're way off of that 60% or whatever it is, it's telling us something. Whether cows were too thin going into breeding, it lets us know if there's something we need to look into.
You bet. And that's why I always found data. Everybody wants data, and data just gets you to the place that you need to be looking.
Right.
Whether it's a feed yard or a cow herd. If I need to be in the processing barn or in the hospital or with the pen riders or whatever, we don't really know what the root cause is until we start stepping on the farm, which is another thing that when you're working with a veterinarian, a professional that's doing the pregnancy determination, now you have a set of eyes that it goes beyond the yes, no, or even the staging. Now it's like, okay, if there's an issue, let's fix it.
Right. And even judging progress you're making. It's right. Say there is something wrong, or you decide to start working with your veterinarian. You can gauge the progress you're making based on keeping accurate records. Like if you don't, it's just hard to remember what your open percentage was the year before, or it's just tough to keep up on all of that.
Yeah. What should a producer be looking for? Would you say would be typical pregnant versus open?
It varies. Depending on at least in our area range.
Yep.
If they're out on the desert, those cows have to work a lot harder. But I feel like in a 45 to 60 day window, you should be at least 90% pregnant. And again, that can vary, but that's kind of, there's guys that are way better than that, and guys that fall a little bit short of that. But that I kind of feel like you kind of need to be at least that 90%.
It's outstanding. It's great information, folks. We're going to take a break. When we come back, we're going to wrap up with Dr. J.D. Folsom right here on DocTalk.
Hey, I'm Clark Victory. I grew up right here on this little ranch near Chelsea, Oklahoma. Roped and ranched all my life. A few years ago, I had an injury that created what they call a frozen shoulder. And after speaking with the surgeon in Tulsa, he told me that he could make my shoulder better if he did surgery, but he absolutely couldn't fix it. And I called Kansas Regenerative Medical Center. I did the stem cell replacement. By 12:30, my wife and I had lunch and was driving back to Chelsea. We work around here. Some days we work pretty hard around here, and my right shoulder doesn't get sore. It's like a baby's arm.
Hey folks, when we talk about intranasal products, having the right nozzle is important, and Merck has a new what they call CleanVax nozzle that's outstanding for administering Nasalgen. It has a nozzle that helps with the direction and application of the vaccine in the nose, and if you want to receive a free package of CleanVax nozzles, go to valleyvet.com, and between now through the end of September, anytime you order Nasalgen products and you use the promo code DocTalk, they will send you a free package of the CleanVax nozzles. Hope you're enjoying it, they work, and we'll see you down the road. Hey folks, for your firearm and ammo needs, for gun safes and much, much more, and to have it personalized, come visit us at United Patriot Supply outside of Seneca, Kansas. You can also visit us online at unitedpatriotsupply.com. Be sure to say that Dr. Dan and DocTalk sent you, and we'll see you down the road.
One animal has this huge impact on your operation.
BVDV is one of the most costly bovine diseases, with losses of $15 to $88 per head.
The virus will actually cross the placenta and get into the fetus. As it's developing, its immune system will recognize that virus as it's supposed to be here. And so then that's where our persistently infected animals come from. They're going to shed that virus their entire life, and then it's going to impact your operation.
It is important to work with your local veterinarian and partner with IDEXX for the best solution for your operation.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. J.D. Folsom. Dr. Folsom is a veterinarian. He's in Rexburg, Idaho, which is a beautiful part of the country, and he owns and operates the veterinary practice there, Cattle Health and Reproduction. Pretty much an exclusive cow-calf, cattle feeder type veterinary practice. And so when you start to line up and you think about, okay, what are some key areas that if I'm going to talk to my producers to prep cows or to have positive outcomes on reproduction, what are some of those things that you're visiting with them?
A big thing we hit on are like vaccine protocols, timing of the vaccine, body condition. I feel like that's probably one of the biggest things that we talk about, and that's like turnout when they're breeding, and even it's a good gauge when we're preg checking. Usually it's around weaning time. I feel like you can get a pretty good feel for range conditions, mineral status of those cattle. Like at preg check, you get hair coats are rough. I mean, I just feel like we can kind of judge, I guess, guide the conversation of what things need to be discussed kind of based on the condition of the cow. I think that's probably the most important thing to discuss.
Well, so I think you hit on the big ones: body condition score, coat, just the appearance of the animals. I mean, you can tell. And then the vaccine, relative to breeding, what are you what would be your optimum range? Number one, we always clarify, work with your local practitioner.
Right.
But how many days prior to breeding are you looking to vaccinate?
So again, in our area, I mean, kind of the gold standards is to vaccinate. I mean, I was right. Like, if they can get vaccine 60 days before breeding, but I mean, at least 30 days. I mean, nothing within that 30-day window before bulls are going out. We do have a lot of producers where we will develop their heifers on kind of a modified live program. And then as soon as they're confirmed pregnant, they'll go into kind of a killed vaccine program, and they get their shots at preg check in the fall. And a lot of that is just, I mean, those cattle get worked once a year.
Right.
And so, and it's important. I mean, if they are getting worked once a year, again, for me to recommend a safe vaccine, I'm going to recommend a killed vaccine at preg check. But if you're given shots prior to breeding, I mean, again, like I recommend to get those shots at least 45 days in. The earlier you can, the better, but no sooner than 30 days.
We have a lot of veterinarians that just exactly what you said. My pre-breeding vaccines in those non-pregnant females are modified live. but once they're confirmed pregnant, no more modified live.
Yeah.
So,
Yep.
great information. Thanks for being with us today.
Yep.
Really appreciate all that you do. Folks, thanks for watching DocTalk. Remember, always work with your local veterinarian. And if you want to know what we do at DocTalk, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson here with Dr. J.D. Folsom, and we'll see you down the road.
At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, Dr. Dan from DocTalk here. We have some exciting news. We're pretty pumped about it. We'll be on Rural Radio, channel 147 on Sirius XM. We will be on the air at 9 a.m. Central Standard Time, 10 a.m. Eastern, 8 a.m. Mountain. Also, you can find us on the Sirius XM app. Thanks for watching DocTalk. Now thanks for listening to DocTalk, and we'll see you down the road.